Good morning. As always, I'd like to thank Jay and Vicki for interpreting for us this morning. We're going to start with the numbers. The total cases of people who have tested positive in Hamilton County is at 2,047. The difference since Friday is 120. The folks that have been hospitalized in Hamilton County, 375. The increase is 20 since Friday. And the number of deaths in Hamilton County are up to 111. That is a 6-person increase since Friday. So this morning, and we talked about this a little bit on Friday, Tim McCartney is here from JFS. He's the interim director of the Hamilton County's Job and Family Services. We're going to talk about a topic that is difficult but important. And that is child abuse and child neglect in Hamilton County. And I'm going to let Tim talk about these dynamics. When we first started here and there was the stay-at-home order, we saw the numbers of cases drop in Hamilton County related to child abuse and neglect. Unfortunately, though, that is not an indicator of what's actually happening out in the community. It's an indicator of what's being reported. And so because the kids weren't interacting with adults at school, at daycares, some of the reporting numbers dropped off. And so Tim is going to talk about what those numbers mean, where we are now as we start to open up again, and what we individually can do in response to what we see and what we think we know. But before we get to that, I've got to, I went out to Delhi Township late last week on another run to Rose Sturtz's house. Remember, Rose is the Delhi Township trustee, and she and some of her friends have been sewing furiously these masks. They're cloth masks, and we've talked about this a little bit before. And so originally, those masks were being sewn for JFS workers. Remember, JFS workers are frontline workers who are still out in the community doing those home visits to make sure the kids are safe. And so they needed the masks. And they've got some surgical masks. I know EMA has provided some masks to them as well, but we wanted to provide them with these cloth masks, and so that happened. And so as we talked to Tim about the needs at JFS, there was this idea that, you know, who needs masks or will need them as we start to open up here are the kids in foster care as they go out to some of the visits to the doctors, to the therapist, to biological parents. And so then Rose and the sewing circle started sewing masks for kids. They're a little bit smaller, as you might imagine, than the other ones. And I've got what I like to call a pretty good sized shipment of these masks. So I'm going to go grab them. They're about 500. I'm going to give them to Tim. And then we will, well, I'm just going to show them actually. Hold on one second. All right. So I have to hold one up, don't I? So there are 431 kid-size masks here. So these are the masks. And I don't know if you can see this, but there are dinosaurs. Don't get too close. There's a Bengals. There are whales and pigs and adorable. So thank you to Rose Stirs and her sewing circle for doing this again. There are about 1,800 kids in foster care, so there's a great need. But this is in addition to what she's done in the past. So it's really very sweet, and they've obviously paid a lot of attention to the material that they're using. So it's just an example of what people are doing. I mean, there are some things that are not great going on. There's some really good things going on right now, and people really stepping up. So thank you. All right, so with that, Tim, as I said, will go into more detail about the topic at hand today. The message we want to send out to people is that we all can actively engage in trying to identify abuse and neglect for kids. I mean, this goes really at any time, but especially now as we start to interact or at least see kids in our community. So a couple things we can all do is check in with families that are at risk, we can just pay attention to kids as we encounter them, as we move through these next couple months. And I'm going to let Tim talk about the website where you can go. We all know about 241 Kids and how that is a way to report something that is concerning. But I love this part of the website for JFS. It says, JFS, and I'm not going to go into, I'm going to let Tim do it, but the last part of it is, do ask, do tell. Do ask, do tell. And that's our space. So with that, Tim, I'm going to turn it over to you and let you talk about what you're seeing.
Thank you very much, Commissioner, and good morning. And good morning to everybody else. And just first to echo what the Commissioner said about Rose Sturts and her sewing circle. That is just truly a magnificent thing and so welcomed by our organization. Frankly, we're almost, when she said, how many do you need? We almost didn't want to tell her because they had already made 100 masks or so. And when we said 1,800, but do your best, I'd say they did their best. And it's just truly a magnificent thing, as the Commissioner said, of people truly stepping up in the selfless care of others. And that's something that our organization, Children's Services in particular, relies on. As the Commissioner mentioned, when the stay-at-home order went into effect, we saw a precipitous decline in our calls of abuse and neglect to our 241 Kids hotline. It was about a 34% decline. And then, the Commissioner began speaking about it here. We did some interviews with all of you. And for the first and I hope only time in my career, I will say that I'm glad to see that calls to our hotline are up. They're not back to pre-pandemic numbers, but they are up. And that's thanks to the Commissioner making this publicly known and you guys in the media covering this. It's really been helpful to see that. We average about, in this time of year, because different times of year, about 281 calls to our hotline in a given week, and that dipped substantially during the pandemic, down in the 130s, and we're back up over 200 now. So again, not back where we want to be, but much better, and that is because of you guys out there. This is not the mandated reporters, because they're not seeing the kids, the teachers, and the daycare folks. This is you out there in the community seeing something and saying something, and we very much appreciate that. We will see child care centers open up, I think, at the end of this month. We do expect to see an uptick there, and you just need to keep being vigilant as people get out and about now that things open up a little bit more. Some of the things that you can look for, and these are detailed, as the Commissioner mentioned, at hcjfs.org under the Children's Services tab. Do ask, do tell. Lists a lot of things, a lot of signs that you may see in kids as they get out and about. If you see unexplained burns, bruises, a broken bone that you were unaware of, those are the kinds of things that may give you a tip. If you, again, always, if you see children unattended or people don't seem to be home, those are things to have a level of concern about. Children their behavior is substantially altered from prior to the pandemic. Either they're much more compliant or much more aggressive. If they tend to really shy away from adults and those sorts of things. Those are things that again, as the commissioner said, do ask, do tell. Call us. Let us know. If we're aware of something, we have the opportunity to look into it and get that child the help that they may need. The sad fact of the situation is always that home is not always a safe place for kids. And during this pandemic, when people have been holed up, some of the factors that lead to child abuse in the first place, substance abuse or mental health disorders, get exacerbated by that. People don't have the stress relievers that they might have had normally, and those things can lead to very, very bad consequences for children. But again, to reiterate the message from the beginning of this, you guys out there have done a great job of stepping up and letting us know about situations that have happened. The numbers that had been falling dramatically are now starting to come back up. They're much more like summer numbers that we see. So keep doing what you're doing. Keep reporting when you see something that just does not feel right to you. Thank you again, Commissioner, for having me. And we can take any questions that you would like.
Thanks, Tim. Really appreciate it. It's a really important topic. All right, Bridget, I believe we're ready for questions.
Yeah, Scott Wortman from the Inquirer has a question for you, Commissioner.
Hey, Scott.
Hey, good morning. Over the weekend, we saw issue with some bars, particularly late in the night, in the city of Cincinnati, Rosedale and the Blind Pig being notable examples of guidelines not being followed. I wanted to see if that was also the case out in the county, if you had any issues with establishments out there, and what, if any, action or fallout will happen. What action will you take if that does happen or has happened?
So I called Greg Kesterman, the interim commissioner of health for Hamilton County this morning to ask him this question because I was just wanted to know what he saw over the weekend. How did it go? Some of the establishments were open, particularly restaurants for outside dining, as you know. He said they got relatively few phone calls, about 15 countywide. And remember, his jurisdiction's outside the city. It also doesn't include Norwood or Springdale, but it's the rest of the county, that's a lot of area to cover. And so he had 15 complaints. He said most of them were relatively low-level complaints. Some of them were not even related to restaurants. One of them was related to a person running a cash register not wearing a mask, so an employee not wearing a mask. So there were a variety of complaints. They addressed all of them, and so he was pretty comfortable with what was happening and what the response of the health department was.
If there is a situation like in the city, is that going to be something that's going to be referred to the prosecutor, or where is the teeth to the regulations if it does get out of control?
Well, and so Greg is kind of the first, Greg and his team, of course, over at Public Health, are kind of the front line here. When you call, you have a concern about an establishment doing something they shouldn't do, you call the health department and then they determine, is this a situation where there's a fine? Do they need to close it down? I mean, I think it depends, obviously, on the level. And then there's the local law enforcement component, too. So depending on which jurisdiction you're in, those local law enforcement agencies have some authority, too. So it varies because the county is so diverse and has many jurisdictions, so it's a little bit more difficult than the city, one health commissioner, one one safety department. It's a little more challenging, but Greg said he felt pretty good about how the weekend went and how people were behaving.
And just one final question. I mean, the city is in the county. Should there be any fallout from what happened with the at least those two establishments in particular?
Well, remember that the city has a different health commissioner, and so she is making determinations, just like Greg is making determinations in his jurisdiction. And so I leave it to the city to police and make those determinations.
Thank you.
UVXU for you, Commissioner.
Hi, Denise. I get this is sort of a follow-up to what Scott was talking about. On Friday, you showed the chart or the graph showing the declining deaths and hospitalizations, and you said your fear was that as things reopened, behaviors would change to the point where you no longer saw that trend. So you've had 3 days of things reopening now. What did you witness? What did others tell you? Are you concerned that things didn't go perhaps like you would like?
Well, let me tell you what I witnessed. So I did feel an obligation to move around a little bit on Friday just to see how things were going. And so I drove around a little bit throughout the area. I was curious to know what streets were being blocked off, what the barriers looked like, how far apart the tables were. There was tenting in some of these places. And so, I drove around, and then I actually went to one restaurant, had outside dining. This particular restaurant, and this is part of the reason I went there, they were seating people at every other table. So there was plenty of, it was well over 6 feet, table to table. The folks working there all had masks on. Many of the patrons had masks on, other than when they were eating, obviously. But we all had entered the facility with masks on. And so it was being done in a way that was safe. I mean, they were following all of the guidance that we have received from public health about how to start to reopen gradually, but in a safe way. And so that was my personal experience. Obviously didn't go to every facility that was open, but I think there is a way to do this. And I actually talked to the server and said, okay, so this is the outside piece of this. Remember Thursday, inside dining is going to be allowed. I said to her, how do you guys anticipate doing inside dining? Are you going to put up barriers? Are you going to, because they have booths, are you going to seat every other booth? And so we kind of talked through that. The other thing, I used to be a business owner. Before I opened a coffee house with other partners on the west side, we called the health department. I don't want to be in violation of health department rules. And so we called them before we even opened our doors and said, all right, here's our facility. You tell me what you see and what I should be doing differently before we open, because I don't want to be in violation. And so they talked about wipe-offable walls. They talked about having like cages over light fixtures, which is something that we had not thought about. We had recessed lights, so we put cages over the fixtures. So there is a way to do this, right? And they even said that they might call the health department just to get them in, take a look around, you tell me what's safe and what the guidance is, and then we open up. And so there are facilities doing this the right way. Are there going to be folks disregarding, I guess, some of this? Probably. My personal experience on Friday night was that things where the restaurant I went to were going just as they should have been. And I will tell you this, they also unfortunately had to turn some folks away, and they did, because they couldn't have safely distanced them because they had every other table full. So that's was my experience this weekend.
Next up, Chris Wederick with the Business Courier.
Hey, Chris.
Hey, good morning, Denise. And this may be something you have to send me later, but I'm wondering if you could be any more specific on the complaints the health department did receive about restaurants. What was the nature of them, and how did the health department actually deal with them?
Didn't ask for that kind of detail from Greg this morning. I can get it for you. In fact, you know, Greg's going to be here on Friday, so we can just ask him in person. But yeah, his overall tone about it was that things went pretty well. From his estimation, people responded when they went out and talked to them about safe distancing, wearing. So people were responsive to what they were hearing from the health department. But I'll make sure he's ready to answer that on Friday.
Thanks.
Okay, it looks like possibly Jay Hanselman might have a follow-up question.
If you do, we can't hear you.
You're on.
Okay, how about now?
There we go.
Feel like a TV commercial. Can you hear me now? You mentioned the calls that the interim health commissioner said that they received. Did anyone reach out to you personally with concerns of anything that they saw that worried them or bothered them?
I had a very quiet weekend. I spent most of it in my backyard gardening, by the way. But no, I didn't have any calls personally.
Thank you.
Seems to conclude our questions.
Okay. Tim, sorry, no questions. You must have been very thorough. So again, putting this on the radar, right? It's a concern in the community about kids, keeping kids safe. So if you see something, say something. Do ask, do tell. Love that. So again, a reminder about Friday. So Greg Kesterman, the Commissioner of Health, will be here on Friday. And I will ask him to, the restaurants will be open by then. So it'll be interesting to know what he's hearing and what he's seeing. The other thing that's happening this week, we've been talking a lot about the Small Business Assistance Program. So working through that program and the parameters of that to make sure we are having the largest impact we can with the money that is being allocated for this program. Remember, there might be a second tranche if it goes gangbusters and there's a lot of demand for it. So there is a lot of information online right now on the county's website, hamiltoncountyohio.gov. Scroll down and you'll find information about the documents that small businesses need to provide, about the parameters of the program, which we've talked about before. I expect the launch is going to be this week, probably Wednesday. So I don't want to lose time here because we're going to try to have that window of time where small businesses can apply, fairly quickly close that window, do the lottery, and the money will go as quickly as possible out the door. So look for that. If you're a small business or know someone that runs a small business that might qualify, that has been impacted by the pandemic, please have them go to our website. We really, really want to try to help, and this is our way of doing that for small businesses. So look for that on the county's website. Other than that, thank you for joining. Thank you for interpreting, and we will see you on Friday.